Our first topic is building the team. In this section, our panelists are going to discuss the pre-implementation phase and share who they would choose for their glycemic A team. Our first question is, can you share the journey of why you decided to implement a clinical decision support tool for glucose management? And I will ask Christy to begin.
Sure. In central Pennsylvania, we really wanted to take better care of our patients and decrease the cognitive and task saturation for our nursing team. As it relates to insulin drip, we looked at both our reported and our anecdotal medication management opportunities. While we reviewed these, we recognized that the cognitive burden that our traditional dosing model placed on nursing, made patients on insulin drips very, complicated to manage. And what we heard from our nursing team is that the way that we dosed and used a linear dosing regimen with very specific administration instructions were really open to interpretation and led to variability in care. So, we saw this when we learned about EndoTool as an opportunity to mitigate that cognitive burden that we place on nursing and decrease that variability. And we were hopeful that along with that, we would see decreased hypoglycemic rates, decreased time to goal, and decreased length of stay in the hospital, all of which we have been able to realize since our implementation. So that was really our driving force behind the transition to the glucose management tool.
I love that you had such a awareness of your nurses' pain points and vision to help them. Jennifer, what was the journey like at Wake Forest?
Well, we had some great systems already in place. Our endocrine physicians and a glucose management team, which is comprised of APPs that work with that section on endocrine. Of course, we're already taking care of patients. We already had our glucose management subcommittee that I already talked about in place, and that committee had been monitoring metrics and improved glycemic management processes over several years. But even with that work and improvements to order sets and other workflows, the data were still suggesting that there were improvements needed, looking at hypoglycemia rates, looking at length of stay, especially for patients with DKA, looking at the adverse events that were being reported in our electronic system. They were not where we wanted them to be. The section head for endocrine, even for a few years prior to our EndoTool implementation, had been working to help our leaders understand the value of an inpatient glycemic management tool. He had experience with a tool in a different health system, so he knew the value and had pushed to implement it. And so the section head, along with his business administrator within endocrine, created the business plan, and we used the metrics that were previously mentioned to help justify the tool.
I love it that you guys were relying heavily on that data and then the experience of another that there was a better opportunity or option. Megan, what was the journey like for HCA?
Well, we similarly had some opportunities to improve our quality of care in the ICU with a paper protocol that had a lot of variability. We actually did a study, our med safety committee did a study with I think it was like 30 nurses to do the same insulin drip, and there was just widely variability up to 15 units at one point if you got off the model. And so we had faith to improve our care and wanted to implement the tool to not only reduce that variability, but also give our nurses some confidence and decrease their workload with using the tool, and also help reduce length of stay, because with very high variability comes longer times on insulin drip.
It's really amazing how the data really played into that, but then looking at the nurses' burden, cognitive burden, as you mentioned there at UPMC, how all of that came together to start this. Our next question is, if you had the freedom to assemble your dream team for glycemic initiatives, who would you bring together and why? And for this one, Jennifer, if you don't mind to respond first.
I think to have a dream team, you definitely have to have an interdisciplinary team. It's critical because all of us bring something different to the table. A physician champion from endocrine is a must, I believe, along with APPs that work alongside of that section to take care of patients. Pharmacists and nurses are who are well versed in glucose management challenges are also important, along with nursing educators and nursing leaders. It is extremely important with an implementation like EndoTool to have strong nursing champions because it does have a heavy nursing component. It can also be helpful to have teammates from the laboratory as well due to the heavy need for point of care testing devices and other lab values. Teammates from your EHR build teams, a great addition, especially teammates that work within the pharmacy and inpatient operations team. I know at our institution we have Epic, and so we had multiple teams within the Epic system at the table with us. Anyone who is on the financial side, like that business administrator in endocrine, can help with your budget needs. And I think it's important not to forget about our pediatric colleagues, consideration for pediatric endocrinologists and APPs, along with peds pharmacy and nursing. They can have an important seat at the table as well.
It is amazing. I want to say there may not have been anyone you forgot in that group for the interdisciplinary approach. Megan, what would your dream team look like?
Well, I think Jennifer nailed it. But you know, for us, I feel like we did have that physician champion who really wanted to you know, improve care across the hospital, and you know, using my team of APPs, seeing patients, managing you know, the insulin inpatient, utilizing EndoTool in our ICUs. Our diabetes educators play a heavy role in getting those patients home and making sure we're setting them up for success at discharge. As she mentioned, you know, pharmacy and our EHR colleagues were huge in making sure that, you know, the order sets and things we were implementing were clear and concise and, you know, very direct at what we wanted, and not too much fluff where, you know, nurses could get lost in the orders and what they're supposed to be doing. And then, you know, as you said, nursing is the biggest component. They're the ones that have to execute all of our ideas. So having them on board and engaged in improving glycemic management made us successful.
That's amazing. Christy, what would your dream team look like?
Well, it's very difficult to add anything. I really think the two other panelists covered this in detail, but the one thing that I think that I would add to that we've learned, especially through this project, is that data analysts are so important as we're looking at these initiatives, because we need to measure these outcomes, monitor the success, and aid in decision making if we're going to modify any parameters. You know, really digging into those details, I have found to be really helpful, especially in our post-implementation phase, so that we can then take those, you know, results back to the nursing team, the clinical team taking care of the patient, and show the successes.
I think this is an amazing thing to hear each of you share. It's definitely an interdisciplinary approach, but mentioning even down to the lab, the EHR, and then the data analyst, that's amazing. I think we sometimes forget those when we're focused on physician, nurses, and those important components of the team.